Thank you very much. I'm very happy to be part of this very important webinar, which is also part of the World Malaria Day celebration and promoted by Merck and others. So my presentation is on healthcare system strengthening through capacity building. And this is really part of a microscopy capacity building in collaboration with Merck. So the outline of the presentation is simple. First, I'll just briefly show what is Noguchi Memorial Institute for Medical Research, and then give a brief on the Ghana malaria strategy to fight malaria and the challenges that are there, then the need for continuous capacity building of health workforce, and then show also the capacity building programs from past collaborations for Noguchi, and then the collaboration of Merck and Noguchi for this particular effort, and then what we hope to achieve. So really, the Noguchi Memorial Institute for Medical Research is one of the world leading biomedical research institutes. The institute is just 41 years old, established in 1979. It was built and donated to the government and people of Ghana by the government and people of Japan at that time. And the mandate of Noguchi is threefold. First, to conduct research into infectious and non-infectious diseases of public health importance. And we know that public health importance in today's global village, a disease in Far East, name it, which China, acute respiratory syndrome, is as of importance in Ghana as anywhere. And the second mandate is to build capacity, especially training of the next generation of scientists, and also to build a capacity of health professionals. And our third mandate is to provide specialized diagnostics and monitoring services, surveillance, in support of public health. So Noguchi was recently just upgraded last year by the addition of an advanced research laboratory, which you can see in this slide. And this laboratory is bringing into sharp focus the works done on virology, bacteriology, and also in immunology. The Ghana malaria control strategy is very well established, and Ghana really is an endemic country. Malaria is perennial in Ghana. It has been with us for ages, for centuries, and the population 100% is at risk of malaria. And malaria incidence in the country is reasonably about 270 plus per 1,000 population. And really the impact of malaria is high because about 40% of outpatients department visits to hospitals are caused by malaria. The strategy of the National Malaria Control Program of Ghana really is based on an integrated approach of building the capacity for control and elimination and eventually eradication of the disease. But it's looking at reducing malaria morbidity and mortality to about 75% of what used to be the burden in 2012, and to reach a target of 75% reduction by 2020. The key inputs into the strategy are overall health sector development, improved strategic investments in malaria control, and increased coverage towards universal access. But really there are three major thrusts that is based on prevention of malaria through, let's say, intermittent preventive treatments, IPTP, for pregnant women, for infants, insecticide-treated net usages, and IRS, and also the second thrust is diagnosis and treatment, and this also focuses a great deal of effort for treatment, for diagnosis, for example, on the use of microscopy for diagnosing malaria, and also the use of rapid diagnostic tests. And the third thrust is mainly based on surveillance. So surveillance, including DHMIS, including data quality, issues, and also research into households and science-based, action. Basically, the situation of malaria in Ghana appears to be increased cases, but really this is not because there are increased cases. The efficiency of control of malaria and management in the country has improved. So increased cases are due more to the improved access to healthcare by the populations, the laboratory testing which is enhanced, and also the surveillance. So a lot has been achieved since this program has been ongoing, but there are still quite something to be done. Basically, malaria microscopy gaps and challenges are there. Malaria microscopy, is the gold standard for diagnosis of malaria. So really, globally, microscopy is being used to do a lot of, improving the control. However, much of the microscopy is being done by very few countries. For example, India is doing most of the millions of microscopy done. Let's say 2017, about 208 million patients were tested by microscope, but mostly in India. In Africa, there are far less testings being done, and this is mostly also due to fewer quality assurance programs and quality or expert microscopists being available to carry out the task. Microscopy basically is a useful tool, and preparing samples for blood samples for microscopy is not so, and it takes some time, but not so much. Like an hour you can finish preparing a slide, and an expert microscopist can read a slide in about 20 minutes, which is quite encouraging. And the level of detection of malaria parasites in slides that have been prepared is about 10 to 50 infected red blood cells per microliter of blood. The cost of microscopy is not too high per se, about $4 to $5, dollars, so $0.4 dollars per slide, plus technician time. So basically, the World Health Organization has come up clearly with the health system framework, which has 6 thrusts, including health workforce. And the health workforce is a very, very important part of the health systems framework, because it has direct influence on access and coverage, and also quality and safety. And with the trained workforce that is up to the task, we are able to also leverage improved health, leverage responsiveness, social and financial risk protection effects are achieved, and there is also improved efficiency. So building the capacity and competencies of the workforce is really a critical aspect of the malaria control effort in nations and globally. At Noguchi, we have built, we have a history of capacity building, organizing various training programs that have been done over the years to strengthen malaria control and others. One of them, which is very important, is a training program that was promoted and sponsored by Japan through JICA, the post-Ebola laboratory capacity building third country. And in this program, the Noguchi Memorial Institute for Medical Research is the implementing institution that provides the training. Japan provides the sponsorship. And the third countries, this training has trained technicians and build capacity for laboratory, technologies from 11 West African countries so far. And we also run various other training programs, including one very interesting one, which we have been running with and the US African Malaria Task Force that has been building the capacity of technologists who are working in military health facilities. And then, of course, we have other training programs for building capacity in bioinformatics and genomics and things like that. So basically, our partnership with Merck, we are looking at a partnership that would contribute to building health systems capacity in Ghana. We are looking at this partnership that will enhance greatly the laboratory technicians' capabilities for microscopy. We are looking at a dedicated program that we call it GALAC, which means Ghana Laboratory Capacity Building Program. And we are focusing this training program on an objective to build accuracy in diagnosis of the disease. We also are looking at a program that will naturally be able to train the technologists in a way that they can take ownership of the programs that are involved. The partners that are involved in this program are mainly 5. The Noguchi Memorial Institute for Medical Research, involved in selection of candidates, supervision of candidates, post-training and continuous education. We have the Ghana Health Service, which is doing also main selection and then supervision to ensure that the candidates participants are fairly and adequately distributed across the country. And Merck, which is the main promoter of this program, is providing organizational and facilitating the training materials and sponsorship of the various modules that are required. We also have the Rotarian Malaria partners who are providing funding for malaria stations and continuous relationship with the Ghana business community to ensure good degree of sustainability. And then we have the foundation partner, which is enhancing communication, advocacy, and stakeholder, and to reach the community and link to the health services. What we hope to achieve together in this effort is to strengthen the confidence of the workforce, improve their skills, and of course also provide a knowledge-based, evidence-based capability in the workforce ability to deliver. We also are looking at fostering a sense of ownership and empowering the trainees to be able to deliver on a long-term basis. And we're looking at having training that will enhance the ability of the trainers to deliver quality management systems and also build international standards, ISO accreditation in laboratories for malaria diagnosis. The long-term success or sustainability is a key issue in this effort. So I'm happy to communicate this, and I would say thank you, and we expect to see good smiles and a bright future, and of course a successful control of malaria for the future. Thank you very much.